Yes. Started your timer and here is your question. Right, so if you have read and understood, considering it history-taking station, kindly please begin.
Okay, good morning. My name is Dr. Mohammed Sherbini, one of the surgical trainee today. May I confirm your name and age, please?
Yeah, my name is Lara. I'm 53 years old.
Okay, nice to meet you, Ms. Lara. And today I have been asked to ask you some question regarding your condition. Are you okay with this?
Yes.
Okay, firstly, how can I help you today?
Actually, doctor, I don't know what happened exactly, but my husband just has told me that I lost consciousness, and when I came back
Mm-hmm.
from that, I feel severe headache right now.
I'm really sorry for that. This must be frustrating for you. But in the meantime, I'd like to ask you, when did you first notice this?
Yeah, just 5 minutes ago, all this
Uh,
happened.
Only 5 minutes? It was your first episode, or you have experienced some such a condition before?
No, I had it before. Yeah, I
Uh-huh.
had it.
When was it?
Yes, I had it 5 months ago.
Uh-huh.
With the same headache, but now the headache is so severe.
You can
Okay,
say,
and
I'm sorry to learn this or know this.
what?
Or you can say, I'm sorry to know this.
Uh-huh.
Sympathy.
Empathy, yeah. Continue, please.
Okay, and could you please identify where do you feel the pain exactly?
Yeah, in the middle of my forehead here.
Okay, and regarding the nature of this pain, could you describe it? Is it thunder-like or stabbing or pulsatile headache?
It's just like a clapping, something clap on my head here. The thunder
I'm re-
clap.
I'm really sorry. I see. Okay, and on a scale from 1 to 10, being 10 is the worst pain, how could you describe this pain?
No, doctor, this is the worst pain in my life.
Uh-huh. I'm really sorry for that. Okay, would you like any painkiller right now, or you are okay to continue?
Yes, I'm okay. Okay, yeah.
Okay, and do you feel the pain anywhere else?
No,
Okay, let me ask you a further question regarding this condition. Have you had any head trauma?
no,
Okay, and have you experienced any stiffness at your neck?
yes, some stiffness.
Okay, I'm really sorry for this. And do you have any sensitivity to the light?
Sensitivity to the light. What do you mean, doctor?
Do you see that the light affect your eye or cause you
Yeah, right.
eye
Yeah,
painful?
exactly, doctor. Yeah, yeah, I
I'm really
hate
sorry for that.
light.
Would you like me to dim the light for you?
Yes, please.
Okay, and um, have you noticed any skin rash over your body?
No,
Okay, and have you experienced any increase in your body temperature?
no,
Okay, have you noticed any weakness or numbness anywhere on your body, your legs or feet or hands?
no, doctor.
Okay, um, have you noticed any disturbance in your vision?
No, no changes.
Okay, and have you ever had any fits, like involuntary movements of your fingers or your hands?
No,
Okay, and let me ask you some question regarding your medical history. Have you seen your GP for anything else?
no, doctor.
Uh-huh. And have you had any surgical procedures?
No.
Okay, is there any someone in your family has the same problem?
Yes, just my aunt have the same problem and she died. Am I going
Uh,
to die?
I'm really sorry for that. I really appreciate your concern, but it is too early to judge your condition. We need to do some necessary tests to give us more information and confirm your diagnosis. Are you okay with this?
Yes. All right.
Okay. Do you smoke or drink alcohol?
Yes, I smoke, 10 cigarettes
I
a
mean,
day.
okay. And what about alcohol?
Yeah, occasionally with my friends. Yeah, occasionally at the weekends.
How many units per week,
Yeah,
approximately?
10 units a week. It's not
Okay.
that much. Yeah.
Okay. This might be a bit personal, but I'd like to ask you, what do you do for a living?
Yeah, actually, I'm a nursery teacher
And with whom do you live?
with my husband, James.
Okay. And do you find any difficulty with the stairs?
No, we live in a
Okay.
ground floor. Yeah.
Uh-huh. What do you think might be causing your symptoms?
I don't know, doctor. I don't know what's going on. And I would like
And
to know.
I see. And what are the most concern you have worried about?
Yes, to die like my aunt.
I totally understand you. I totally understand you. And what are you hoping from us to do for you?
I just find anything to help me.
Well, let me assure you that we are doing our best for you. Don't worry. And have you experienced any problem in your medical history, such as difficulty of swallowing or difficulty in passing urine?
No,
Okay. Have you experienced any shortness of breathness or heart problems?
no.
Do you take any medications, such as blood thinners?
But early, I used to have some pills.
Blood thinners or any which medication?
No,
Which
the pills
medications?
for the ladies not to get pregnant. Pills.
Uh-huh. Okay. Do you want to add anything or ask anything about your condition?
No, I'm okay.
All right,
Okay,
good.
thank
Thank
you.
you. Can you summarize your history, please?
Okay, today I have seen Miss Laura, who is 53 years old, came to the ER by recurrent episode of headache. The patient describes the headache as the worst headache she have ever had in the middle of her head. Um, uh, There is no precipitating or relieving factor for the pain. No history of trauma. No, there are manifestation of neck stiffness. No fever. No rash or no manifestation of increased intracranial tension. So based on that, my main differential diagnosis will be and positive family history. Also, she mentioned positive family history of cerebral aneurysm.
Yes,
My main differential diagnosis based on that will be subarachnoid hemorrhage due
very
to
good.
ruptured
Yes.
cerebral aneurysm. And I have also to consider meningitis or manifestation of increased intracranial tension due to brain tumor or uh, meningitis, yes, or brain tumor.
Or migraine, or yes,
Okay. Uh-huh.
encephalitis, etc. Infection. All right. How do you plan to manage this patient? What
Okay.
investigation would you ask for?
I'd like to start management of this patient according to ETLS protocol in the ABC manner to ensure there is adequate airway, breathing, and circulation. And after that, and after confirming that the patient is stable, I'd like to arrange for some bloods and investigations, mainly CT brain or CT head, to show if there is any brain aneurysm or space occupying lesion. CSF tabbing will be helpful if I found any blood in the sample may give a clue about presence of aneurysm.
Yes.
Some bloods such as TLC and inflammatory markers in case of infective or meningitis cases.
Where would you
Um,
manage this patient?
okay, I'd like to discuss the case with multidisciplinary team,
Very
including
good.
vascular surgeon and neurosurgeon.
Yes.
I'd like to refer the patient to a neurosurgical unit.
Yes.
The aneurysm need to be coiling the aneurysm. Okay, and maybe need evacuation of the hemorrhage by doing beer holes or craniotomy.
Very good.
Some medications such as calcium channel blockers causing vasodilatation of the cerebral blood vessels will be helpful also.
Yes. And how would you resuscitate the patient?
Okay, I'd like to start by giving intravenous fluid.
Yes. How much?
Actually,
Over how?
3 liters, 3 liters
Yes.
over 24 hours.
Very good. Okay.
Okay.
Right.
Uh,
Good. Yes.
mhm.
You want to say something?
No. I want to check for oxygen saturation and airway breathing in the same manner as
Same
ABC.
time. Good. Very good. Okay, good.
Thank you.
Excellent.
Thank you.
And one thing, did you ask about the severity of pain, like with the scale of 1 to 10? I think that was the only thing you forgot.
I asked about it. I asked about the scale from 1 to 10.
Oh, you did. Okay, I'm sorry,
Yes.
I missed.
No,
Any
no
cough?
problem. I asked any cough or shortness of breathing in the systematic review.
In the systematic review. Okay, good.
Okay.
Radiation maybe, if headache radiates anywhere. Because you did ask about the character, site, and the location, but did not
I
ask
actually don't
about the
remember
radiation.
if Mr. Sam can confirm that.
You asked about the trauma, but did you remember to ask if there?
I think. Do you feel the pain anywhere else? I think I asked this question.
Okay, like this, but not the radiation. Okay, and temperature, you did not ask if patient is feeling feverish or anything. Yeah,
Okay.
just 2 or 3 small things.
Is it okay to ask the patient directly, do you have a fever or increased body
No, do you
temperature?
feel, yes, do you feel raise in the temperature?
Okay.
And okay, good, thank you. I'll